But we are completely at the mercy of whether the rain falls or whether it doesn't fall, whether it stays in the mountains or whether it, it melts too quickly, whether it's there for the next generation or whether the glaciers are gone. We're not controlling that. We're at the mercy of that. And I think it helps us remember that just because we have water in our watersheds right now is no guarantee that we're going to have them in the same way, shape, or form in the future years. So the other part of that is again Malin Falkenmark from the Swedish International Water Institute, who talks about hydro-solidarity and this idea of people living within a hydrological system in solidarity, living with the water system and the land system, but being really that being the overarching, a dominant framework for thinking about how people are working together. Because as we mentioned, in over-allocated water systems, people start to get stressed about who gets the water and who doesn't get it. And we'll talk about that again in a minute. In this idea of thinking about what policy is and what it means, it's really, I think, especially intersectoral policy. So for me, that's mostly thinking about watershed organizations and public health agencies, but it could also be working with the engineering community, working with the municipality. But it's this idea in systems. If we think about systems, you're never trying to maximize the output of a system. We did that with the cod fishery, and all we did was maximize the maximum sustained yield. That kind of thinking has been really, invalidated because we try to maximize what we take, and instead we end up losing the whole system because we take too much. We don't give the resilience to the system itself to carry on, and then it collapses. New systems thinking says it's not about maximizing, but it's looking for these points, leverage points. So, for example, public health in a watershed setting may never be anyone's first priority. And there may be actions they can take around communication and advocacy that doesn't trump obesity, diabetes, hospitals, all these other priorities. But it doesn't mean that it's not worth doing. Because in a systems perspective, you're trying to look for the points of intervention that add value, that add synergy to the system. You're not trying to maximize, and we're going to solve this problem by doing this one action. You may need multiple small actions that are not no one's first priority, but are the priority of, you can get a collaboration together to take the action. And that's very valuable. So we shouldn't, it's too easy to think, oh, well, that's not my job, that's not my, that's not on my mandate. But it might be sideways, and there might be a way that you can still do the work. It doesn't have to be the primary mandate. Just wanted to point out, so if we're looking at leveraging co-benefits, for example, so we have this idea of a watershed organization that transcends established political boundaries, which is, I think, one of its most useful reasons for existing. In public health, they have a different kind of set of priorities, like I mentioned: health promotion, health protection, preventative interventions, health assessment, disease surveillance, health emergency preparedness and management. So you don't see water, watersheds, hydrology, anything in there. But you can see them because they are there, embedded in what is health promotion or what could it be. Also populations and inequities, of course, for public health are big themes, and I put wellness with a bit of a question mark, but in theory, wellness is a part of the public health mandate. And the principles, if you want to talk about public health, and I think they're important for us to constantly question ourselves, is what is the need? What is the need to integrate? What drives it? How can we justify working together? And we're not articulating the needs maybe as well as we might. So in public health, in the standards, public health standards, we need to show need, impact, capacity, and partnerships and collaboration. And I think for watershed organizations to begin to integrate their thinking in areas that are strategically important, being able to show and articulate that need is very important. And I don't think we do maybe as good a job of that as we could. I just wanted to end by giving a few examples of where this idea of thinking about public policy as strategic direction that guides a certain kind of behavioral change could be kind of an interesting way to start thinking about leveraging the co-benefits of working together, working intersectorally, and working with other groups. So on the very specific side, of policy. So this idea then, intersectoral collaboration will leverage scarce resources to enhance human health and ecosystem resilience. If that was a policy direction that we took, if we started to think on a watershed organization, that we're doing this, we want to work with others because we want to leverage scarce resources. Well, then how do we do it? What are the instruments that we use? So we have to meet others. We have to have regular meetings. We have to reach out and create, a conversation. Having those meetings is an instrument that we would use. Development and publication of collaborative research or policy positions. Like Margot, I think she'll talk later about her policy position paper with Northern Health and thinking about watershed organizations. Educational materials. So those are ways that we can say working together is strategically important. It helps us get our work done more cheaply. This is how we're going to do it. Mental health and wellness, as well as social equity, can be promoted locally through access to healthy ecosystems and engagement in ecologically minded community groups. So we can make a mental health argument for why watershed organizations are important, why public access to resources is important. And again, but there are specific actions we could take in order to make that happen. Community and youth engagement with local ecosystems is a form of health promotion. Okay, so we can talk to people and say, this is about healthy communities, and that's why we want to have youth cleaning up streams and doing all these things. We can start to speak other people's language. On the other side, big picture things, and I'm not advocating these as strategic directions. I'm hoping they'll play some thinking. For example, integrated surveillance programs, human animal environment can prevent the escalation of health problems. So if we believe that, and if we think that's a strategic direction that we want to invest in, then we need to find ways to share data, work together, et cetera, et cetera. Upstream, downstream water equity considerations affect land and water use decisions. Upstream, downstream equity. We've already talked about the Lake Winnipeg situation, where they're receiving heavily eutrophied waters from Manitoba, Saskatchewan, and Alberta. So what is the equity issue? Who has responsibility? How do you work together? What's the hydro-solidarity in that basin? And for example, in Costa Rica, they have payments for environmental services. They understand that in most watersheds, the downstream users are more powerful, richer, tend to be urban, and they value clean water. It's easier to treat, less costly to treat if the water's not already dirty. And so they have a system where they're paying rural landowners to clean up, improve their land management because they understand that they're in a hydrological system and it's actually more efficient to work together. What if wild salmon and trout stocks were considered fundamental to the Canadian identity and they could be protected for present and future generations, or 7 generations? If we really cared about salmon or trout, we would have to manage differently. We would have to have different policy instruments in place to create the kind of behavioral change that led us in that direction of how we live in the world. And these are value-based choices, and that's what we have to articulate better. What are the values guiding our work? Because that affects the kind of public policy we have, the instruments that we use, and the kind of behavioral change we look for. 3 more, and then I'm done. Contaminant transfer threatens the integrity of Canadian ecosystems and the health of Canadians. If we really cared about eutrophication and contaminants, we would have different law and policy. And I know everyone says, oh, the economy won't support, the economy won't support. Well, if the collapse of the financial system in the last 2 years taught us anything about the economy, it's that the economy is a social construct. And so we need to not lay down dead in front of economic arguments. But we have to fight back and say, well, actually, there are ways to change subsidies, to change behavior, to change the values underlying the decisions that we're making to have different kind of society. Nest and watershed organizations allow for context-specific thinking about changing land and water resources and their impact on population health for current and future generations. So again, it's about thinking about these things contextually, but remembering that this is about how we live in the world, this is about the health of present and future generations, or it could be, if that was the policy direction we wanted to take. If we thought about it in health terms, we'd have different ways of thinking about what we did in terms of the watershed. And the last one, access to clean, affordable drinking water is a basic human right. Okay, that language is circulating internationally. We don't really use it in Canada. But when we start to think about over-allocated river basins, and source water protection. You know, what is the rule? If we really valued water, clean and affordable drinking water as a basic human right, we would have different ways of, you know, acting in the watershed basin and prioritizing different kinds of water uses for the long and the short term. So it's one way of thinking about public policy, is to come back to solving real world issues with, and thinking about values. And if you do that, I think it helps a lot for us to articulate why we're here, why we're talking about watersheds and integration, but where are we trying to go? What is the strategic direction or directions that we're really pushing and advocating? And is it just more of the status quo, which is fine? You know, doing nothing is always a policy option. But if we're trying to do something, I think we'd have to articulate the values behind that a little bit more clearly. So other thoughts and ideas, and thank you very much.